Ya, kalau ada orang luar ke join sekali. Ada menteri-menteri, ada. Ha, ada kita-kita je lah. Paling atas dekan lah. Paling atas dekan lah. Ni perubatan saja Oh, penelitian master. Student bawah Cik Ma. Student bawah Cik Ma punya lah. Student bawah Cik Ma punya lah. Yang ada grad lah. Ada grad lah. Ni baru nak mula kan? Oh, yang Prof Yang tu yang dah.
Check 1 2, check 1 2, check. Check, boleh. Okey.
Check 1 2 3. Check 1 2 3. Macam tak dengar je gitu. Macam tak dengar je gitu. Ada? Okey.
Assalamualaikum warahmatullahi wabarakatuh. Then we will straightway continue with our opening ceremony. Thank you.
I off my video. Makin fast and Zoom meeting dia kelan dia event. Rasa ni event day 30th November. Yeah. There's a form here. I just clicked it.
Bismillahirrahmanirrahim.
Burung tempua hinggap merata, sayang merbah di pohon cemara. Assalamualaikum, mula berkata, awal bismillah, pembuka bicara. Mawar di taman mekar nan indah, harum mewangi di rumpun serai. Terukir senyuman, pembuka kalimah. Selamat datang, tuan-puan yang diraikan. Assalamualaikum warahmatullahi wabarakatuh and very good morning to all. Yang berbahagia, Profesor Datuk Dr. Adibah Kamaruzzaman, Dean of Faculty of Medicine, Universiti Malaya, Profesor Dr. Syarul Bahiyah binti Kamaruzzaman, Deputy Dean Postgraduate, Faculty of Medicine. Yang berbahagia, Datuk Dr. Haji Raizat bin Haji Yun, Deputy Director General of Health, Medical, Ministry of Health. To all Head of Department, Head of Unit, lecturers, and to all Clinical Masters, candidates 2020-2021, welcome to our new normal virtual orientation for Clinical Masters Program Session 2020-2021. Jejaran mengkudu berbias kesuma di celah angsana di tanah Jawa. Ucapan aluan pembuka bicara di Dewan Virtual Gemilang Indah kita bersua. To begin our welcoming ceremony, it is my great pleasure to invite the Dean of Faculty of Medicine, Professor Datuk Dr. Adibah Kamaruzzaman. Prof.
Bismillahirrahmanirrahim. Assalamualaikum and good morning everyone. Yang berbahagia Datuk Dr. Haji Raizat bin Haji Yun, Timbalan Ketua Pengarah Kesihatan Perubatan Kementerian Kesihatan Malaysia, Profesor Syarul Bahiyah Kamaruzzaman, we're not sisters. Timbalan Dekan Ijazah Tinggi, semua ketua jabatan dan pengacara majlis dan juga ketua jabatan Sukan Perubatan Dr. Naha. It gives me great pleasure to welcome all of you to for your clinical masters, for the start of your clinical masters training. We know that this has been delayed by approximately 6 months because of the COVID pandemic. I'm sure all of you have been involved directly or indirectly with the administration of COVID services throughout the country. And but I've also been very keen to start your training. I think many have been asking when we were going to begin the master's program. I just want to take a few moments to acknowledge Datuk Dr. Haji Raizat's presence. As many of you know, he is Tan Sri DG's right-hand man in ensuring that the COVID response in the country is as seamless and as good as it can be. And for him to take some time off this morning to be with us, I think he really deserves a big thank you, Datuk. I'm not sure. You are on the other side, yeah? Of the... This is quite it's quite disconcerting because we know I think that Datuk Raizat is on the other side of the Alam Maya. And in any case, thank you for choosing to do your training at I think most of you probably have heard that the training here is very hands-on because we have a very, very busy hospital that you will be part of the family of, providing services as well as getting trained at the same time. We have the full suite of specialists, consultants, super specialists here that hopefully you will be able to spend time and get your experience and training as you rotate through the different specialties that you have chosen to be trained in. We take pride in the number of patients that we serve, but also the breadth of experience amongst our clinicians, and also in the preclinical departments, that some departments work closely with, including, I think, clinical oncology and anesthesia. So please do, take the opportunity to, get to know your consultants, as well as the fellows that are attached to the different units for which you have chosen to make your specialties. We also, I think this is going to be some of the most stressful time for all of you. You are entering into a period of your lives where you are expected to train, you are expected to give service to a very busy hospital, you're expected to study and pass exams. And then on top of that, you all are either starting your families or have very young families. Many of us have gone through the same experience as you have, and I acknowledge the difficulties that all of you, many of you, will face throughout these 4 years. What I want to say is, in terms of ensuring your resilience throughout these 4 years, please ensure that you look after yourselves. I think it's very, very important that you look after yourselves, take time for yourselves, and don't let the sometimes it can get to be very overwhelming. Don't keep it to yourselves. We have, of course, your first port of call will be colleagues or seniors in your department, but there are also counselors both at the hospital and at the faculty to provide you with support. This is essential, I think, because if you don't look after yourselves, it's very difficult to look after others. I'm not going to bore you with the facilities that are available at the hospital, as well as at on the faculty side and the university side. You will have access to a very good virtual library collection that hopefully will help you with your studies. There are facilities at the library and others. It's a bit detached. I mean, it's a bit far, not that far away from the hospital, but there are spaces for you to get away. But I know most master's trainees have hardly any time to. But like I said, it is sometimes very important to get away and take a bit of time for yourselves. Normally, this orientation program stretches over 2 days. We have a very comprehensive introduction to medical law and medical ethics, because we acknowledge that this is something that is not very well taught, even here at but in most medical schools. And given that you will be providing direct services and will be to some extent responsible for patient care, even under the supervision and guidance of all of us, it's extremely important that you understand the medical ethics and medical law. We have truncated it into a 2-hour program, what used to be a half-day program provided even by senior lawyers, senior medical lawyers in the country. But we hope to supplement that with some online content later on in the year. And also the program used to involve quite extensive visits to the hospital and all that, which we have, because of COVID, necessarily have to be modified to suit the current situation. So I don't want to belabor this morning because we have a full program with Prof. Sharul going to detail some of the administrative as well as the structures of the program. And of course, we'll be inviting Dr. Rahaizat to also address all of you. So with that, we're very, very happy to welcome you to the family. You are, in a way, classified as students and trainees, but we acknowledge that, you're actually very, very important people who provide service at the hospital. And I hope you will regard this, the hospital and the faculty as your own, even though, by designation, you are students. So with that, we hope you have a smooth and productive journey with us in the next 4 years. As I said, we're always here to help you. And we hope that you too will uphold all the professionalisms and ethics in terms of your daily interactions, not just with the patients, but with your colleagues, as well as other members of the team, like the nurses, like the PPK, and others who also are an important part of the team in delivering service to the hospital. So all the best.
Thank you, Prof. Adiba. Pakai baju warna biru, pergi bersekolah pukul 1. Murid sentiasa hormatkan guru kerana guru pembekal ilmu. Next, guru I would like to invite is our Deputy Dean, Postgraduate, Professor Dr. Sharul Bahya binti Kamaruz Zaman. I specifically mentioned the last name to make it clear that's bukan sibling lah, to give her speech. Prof.
Assalamualaikum and a very good morning to everyone. It would be an honor to have been called a sister. Anyway, we're sisters, soul sisters perhaps, I hope. Yang berbahagia Datuk Dr. Muhammad Rahaizat, our Deputy DG of Health. Yang berbahagia Datuk Dr. Professor Adiba Kamarul Zaman, Ketua-Ketua Jabatan, Ketua-Ketua Program, ladies and gentlemen, a very good morning to you all. It's wonderful, although different, to see all your faces here this morning looking quite bright and eager. And this unconventional welcome befits our new norms that we are facing. As our esteemed Dean has said, the world as we know has changed. As we welcome you to the Faculty of Medicine, you will find that your typical transition period that occurs upon your introduction to your postgraduate journey, your life, is going to be a unique one. In these, what we call unprecedented times, it's imperative that we, in the postgraduate division especially, are very sensitive to your needs by focusing on our quality communication to ensure that your experience, whether it's 2 years or 4 years, in whichever program, whether it's in your mixed mode coursework, in your research thesis, in your clinical masters, etc., that we have an ensured experience that gives you support, flexibility, as well as ensuring safety in your practice, in your learning, as well as your training environment, both here at the Faculty of Medicine and at Pusat Perubatan Universiti Malaya. Now, as you journey through your studies in our largest faculty here at the university, there will be many, many opportunities to get to know each other, gain new skills, meet new people at various levels of faculty, as well as the hospital. We have a range of learning environments, as you'll come to know during your time here. Do explore our grounds. We have we're centrally located here in KL. There are many, many experiences outside of our working environment. The cultural ones, our traditions, our legacy at I hope you get to know all that during the time that you're here, albeit in a safer environment befitting our new norms here. Now, our goal is to prepare you because you are our next generation of specialists, our scientists, our academicians, and industry practitioners. And I hope that at the end of this, you will have rewarding careers. And this will set a foundation for us all to be involved in building a healthy society through your education, discoveries, our collaboration, as well as research, not within just the Faculty of Medicine, but between faculties across the country and perhaps beyond. Now, as you know, with the world changing, our healthcare and other industry needs have also changed. Now, we've placed here at the faculty, under the tutelage of Professor Adiba, emphasis on the curriculum, its design, and how it's relevant that we deliver it to you in the appropriate way, befitting our current times. We hope that your time with us will drive you into the pursuit of excellence, and that this is fortified by the positive social values that our faculty, the leaders in our faculty, will hopefully instill on you, and so that we may serve our community together and our population very productively. Now, there are many, many different courses here with the largest faculty, as we said, lots of programs. We've got the largest or highest number of programs that is delivered here. There are opportunities for you to collaborate with our fellow colleagues during the course of your research, for example. And perhaps even your thesis will evolve to something a lot more exciting. And, with the international links that we have here, this will be an opportunity to tap into these resources. Last but not least, the entire university community here is here to support, to sustain, and encourage you as you commit to study in UM. We are a vibrant learning community, and I hope that you will find that to be so. We really look forward to hearing your fresh ideas and the energy that you bring. And I look across the faces here this morning, and I'm really, really heartened and positive about what you will bring to our faculty. So, although virtually for now, I hope that we'll be looking forward to meeting you in person. And on behalf of the Postgraduate Division, we're so happy that you've made the decision to join us. Welcome to UM.
Thank you, Prof. Sharul. Next, it is my great honor. I would like to invite Yang Berbahagia Datuk Dr. Haji Raizat bin Haji Yon to give his speech.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh dan salam sejahtera. Yang berbahagia Dekan Fakulti Perubatan Universiti Malaya, Yang Berusaha Profesor Dr. Sharul Bahya Kamaruzaman, Timbalan Dekan Ijazah Tinggi Fakulti Perubatan Universiti Malaya, Ketua-Ketua Jabatan, calon-calon program sarjana perubatan sesi 2020-2021 Universiti Malaya, sertanya para hadirin yang saya hormati sekalian. Terlebih dahulu saya ingin merakamkan ucapan terima kasih kepada Profesor Datuk Dr. Adiba Kamaruzaman dan Fakulti Perubatan Universiti Malaya kerana sudi menyebut pihak KKM untuk duduk sama dalam majlis meraihkan calon baru sarjana perubatan klinikal 2020-2021. Bagi pihak Kementerian Kesihatan Malaysia KKM, saya mengucapkan tahniah kepada semua calon, khususnya pegawai perubatan KKM yang terpilih untuk melanjutkan pengajian ke peringkat ijazah sarjana perubatan di universiti yang ulung ini. Ya. Bak kata perunding motivasi terkenal Mario Teguh, orang yang berhenti belajar akan menjadi pemilik masa lalu. Bagi orang-orang yang masih terus belajar akan menjadi pemilik masa hadapan. Sebagaimana kita sedia maklum, dunia telah dilanda dengan pandemik COVID-19 sejak penghujung 2019 dan negara kita tidak kecuali. Gelombang pertama bermula di negara kita pada 25 Februari 2020 dengan 22 kes. Ya. Dan selepas 11 hari tanpa apa-apa kes positif. 27 Februari, gelombang kedua muncul dengan jumlah keseluruhan kes dalam tempoh tersebut adalah 10,159 kes-kes COVID-19 yang positif. Peningkatan cara mendadak ini menyebabkan Perintah Kawalan Pergerakan PKP secara menyeluruh seluruh Malaysia telah dilaksanakan. COVID-19 memberikan impak bukan sahaja kepada perkhidmatan perubatan dan kesihatan, namun impak kepada aspek-aspek lain, itu aspek latihan terjejas amat teruk. Termasuklah latihan kepakaran sarjana di semua universiti awam kita. Latihan dan peperiksaan klinikal program sarjana perubatan terpaksa ditangguhkan. Dan kita tahu SPM pun mereka terpaksa tangguhkan. Selain itu, tarikh kemasukan untuk pelajar baru juga ditunda dari Jun kepada Disember. SOP baru untuk setiap aktiviti perlu diwujudkan bagi mencegah penularan COVID-19. Kini Malaysia menghadapi gelombang ketiga. Gelombang ketiga. COVID-19, gelombang ketiga sejak 20 September 2020 yang lalu. Terdapat lonjakan kes COVID-19 pada fasa ini hingga mendorong kerajaan melaksanakan PKPB. PKPB iaitu Perintah Kawalan Pergerakan Bersyarat. Bukan PKP, tapi PKPB iaitu bersyarat, dan juga PKPD di beberapa negeri. Di sini saya nak jelaskan dulu PKPD, lepas tu kita sekarang di PKPB. Dan ada beberapa tempat pula PKPD. Dan KKM telah melaksanakan langkah bersifat tuntas dalam mengekang penularan jangkitan COVID-19 dalam masyarakat. Dan langkah-langkah ini akan terus kita perkasakan, termasuklah melalui pengenalan Agenda Nasional Malaysia Sihat, di mana 2021 Walaupun kini kita masih lagi terpaksa berperang dengan kes yang semakin meningkat, namun pada masa yang sama, aktiviti esensial masih perlu diteruskan dengan SOP yang bersesuaian. Perubahan fenomena ini memang tidak dapat dielakkan dan kita perlu terus hidup dengan norma baru ini. Kita perlu terus hidup dengan norma baru ini kerana kita tidak pasti bila COVID-19 akan menghilang. Bagi memenuhi aspirasi kerajaan, KKM sentiasa berusaha untuk mempertingkatkan kualiti dan mempertingkatkan capaian perkhidmatan perubatan dan kesihatan di negara ini dengan peningkatan pakar serta meningkatkan perkhidmatan kepakaran. Tadi peningkatan pakar, dan ini perkhidmatan kita kena pertingkatkan seluruh negara. Oleh itu, pelbagai inisiatif telah dijalankan oleh KKM bagi meningkatkan lagi perkhidmatan perubatan dan kesihatan, termasuklah misalnya inisiatif hospital cluster yang saya rasa semua dah tahu. Kedua, pelaksanaan lean healthcare. Yang ketiga, inisiatif komuniti sihat perkasa negara, KOSPEN, dan banyak lagi aktiviti lain yang telah Kementerian Kesihatan jalankan. Sehingga kini, KKM mempunyai 6,456 pakar perubatan yang menerajui perkhidmatan perubatan yang disediakan oleh 144 hospital dan 2,881 klinik kesihatan KKM di negara ini. 645 pakar tak mencukupi, tidak mencukupi. Dan majoriti pula pakar negara ini, pakar perubatan di negara kita ni adalah dihasilkan daripada program sarjana perubatan. Oleh itu, pada tahun ini kalau kita lihat 8 universiti termasuk Universiti Malaya telah menawarkan slot latihan melalui program sarjana perubatan, dan kita daripada kerjasama 8 universiti ini kita dapat mewujudkan 23 bidang kepakaran. Dan KKM lahirkan rasa terima kasih kepada Pak Universiti, termasuklah Universiti Malaya, kerana telah berusaha meningkatkan bidangan kursus kepakaran, meningkatkan slot latihan dua-dua sekali bagi menampung keperluan negara. Mulai sesi 2020-2021, pelaksanaan program sarjana perubatan akan dibuat secara bersepadu. Yang dikenali sebagai I system, iaitu integrated system, di mana kesemua pelatih diletakkan dalam satu sistem tajaan bagi memastikan keseragaman dalam pelaksanaan program ini. Perkara ini merupakan satu resolusi dalam Convention Program Kepakaran Perubatan KKM tahun 2017 yang diadakan pada 10 hingga 12 September 2017 yang lalu. Mulai sesi baru ini, dual system bagi tajaan open and closed system tidak lagi digunakan. Penawaran slot latihan hadiah slot hadiah latihan persekutuan, selalu kita guna perkataan HLP, oleh KKM telah bertambah ya. Kalau dulu kita dapat 450 slot, sebelum tu 250 slot, lepas tu 450 slot. Kemudian tahun 2013 kita dapat 1000 slot. Lihat 250, 450, lepas tu 600, kemudian 1000, dan kini kita dapat lagi 1200 slot HLP telah ditawarkan bagi calon-calon yang berkelayakan, termasuklah dalam kalangan anda semua yang hadir pada hari ini. Dan jumlah slot HLP pada tahun ini yang paling tinggilah, yang tertinggi pernah ditawarkan oleh KKM. Tapi ingat ya, saya sebut tadi 1,200 calon yang berjaya dan yang memohon lebih dari 3,000. Bermakna tadi 2,000 calon, 2,000 lebih lagi calon tidak berpeluang. Jadi anda adalah yang betul-betul terpilih. Memang terpilih untuk mengikuti, sebab rakan anda lagi 2,000 lebih langsung tidak berpeluang. Oleh demikian, saya berharap tuan-tuan dan puan-puan di Dewan ini adalah calon-calon yang betul-betul cekal, committed, bersemangat tinggi untuk mengharungi latihan dalam program sarjana perubatan. Dan ingat ya, kembali semula kepada KKM pada tahun 2025. Kembali semula, saya ulang balik, kepada KKM tahun 2025. Sepanjang perjalanan, ya, tuan-tuan, perjalanan yang jauh ini sebagai trainee selama 4 tahun, saya menyeru supaya menggunakan peluang sepenuhnya mengikuti latihan kepakaran yang tersedia ini. Ya, ini termasuklah bersikap proaktif dalam pembelajaran, aktif dalam tutorial, aktif dalam sesi perbincangan dan juga kerja-kerja klinikal. Dan perkasakan ya, kuatkan diri dengan pelbagai kemahiran klinikal dan penyelidikan, dan pertingkatkanlah kemahiran komunikasi. Saya ulangi pertingkatkanlah kemahiran komunikasi. Bila nak communicate dengan pesakit, ini kadang-kadang yang banyak aduan kita terima, bukan sebab masalah rawatan tapi masalah komunikasi. Dan supaya dengan ini anda akan datang bergraduat, jadi satu graduan pakar perubatan yang benar-benar kompeten dan benar-benar selamat yang diperlukan oleh negara. Sebagai seorang trainee program sarjana perubatan, anda perlu berdikari, bertanggungjawab terhadap pengalaman latihan anda. Pihak fakulti dan pihak universiti, khususnya Universiti Malaya, menyediakan pelbagai kemudahan, menyediakan peluang dan terpulanglah kepada anda semua menggunakan kemudahan dan mengambil peluang tersebut. Suatu berada dalam program sarjana perubatan, anda semua masih kekal sebagai pejabat awam. Ingat, kekal sebagai pejabat awam. Oleh demikian, tuan dan puan-puan, anda semua dinasihatkan tidak terlibat dalam perlakuan atau aktiviti yang mencemar nama baik pejabat awam. Sekarang ni kita lihat ada yang terlibat dengan aktiviti-aktiviti tidak bermoral, saya dapat aduan dan kita tertarik balik, ada sexual harassment, kemudian ada juga terlibat dengan menghantar maklumat palsu dalam media sosial, menghantar maklumat yang mencetuskan panik. Jadi untuk makluman ada beberapa pelatih-pelatih trainee yang terpaksa tajiannya ditarik balik kerana melanggar peraturan yang telah ditetapkan sebagai pejabat awam. Dan ada juga, kalau anda semua ingat, ada trainee di hospital Johor, di salah satu hospital di Johor dalam bidang ONG. Kalau kita lihat beberapa tahun yang lalu juga yang yang menghantar gambar semasa terlibat dalam delivery sakit, dan juga kita terpaksa tarik HLP beliau. Jadi tuan-puan pun berhati-hatilah dalam berkhidmat dan patuhilah tata cara yang betul. Saya turut maklum ya, untuk makluman saya pun dimaklumkan hari ini telah bertambah satu lagi tanggungjawab tuan-tuan dan puan-puan dalam portfolio peribadi. Ini penting ya. Trainee sarjana perubatan. Remember tu, anda adalah trainee program sarjana perubatan. Oleh itu saya merayu anda semua meneliti keseimbangan antara keperluan pengajian dan juga keperluan diri dan keperluan keluarga, supaya anda dapat menamatkan latihan dengan jayanya. Seimbang keperluan latihan dan keperluan keluarga. Jadi ini memang bila kita dah bekerja nanti begitu juga, keperluan perkhidmatan dan keperluan keluarga diseimbangkan supaya kedua-duanya tidak diabaikan. Bagi tidak mengganggu tanggungjawab anda sebagai seorang trainee program sarjana perubatan, anda dilarang membuat lokum dalam tempoh pengajian. Ini telah pun dikeluarkan ya perkeliling Ketua Pengarah Kesihatan, di mana pada masa itu ramai program sarjana perubatan terlibat dengan lokum dan mereka ramai kadar kegagalan tinggi. Jadi pada masa kini pun saya rasa anda semua tahu kadar lulusnya adalah 38%. 38% saja yang lulus 4 tahun secara direct. Maknanya yang lulus 4 tahun betul-betul berterusan tak sampai 40%. Dan selebihnya lulus juga tapi memakan masa 5 tahun, 6 tahun dan 7 tahun. Dan kami terpaksa facilitate anda semua yang gagal ini. Jadi oleh itu kalau buat lagi lokum dan yang lain itu akan menambahkan lagi kadar kegagalan. So harapan KKM, calon-calon program sarjana perubatan sesi 2021 dapat menamatkan pengajian dalam tempoh 4 tahun dan kembali semula kepada KKM. Kembali semula pada KKM sebagai pakar yang kompeten, yang selamat, dapat memberikan perkhidmatan perubatan dan kesihatan yang terbaik pada rakyat Malaysia. Dan saya harap tuan-tuan dan puan-puan anda semua akan menunaikan sebaik-baik peluang yang telah diberikan oleh kerajaan sebagai pejabat awam. Ini penting, yang telah diberikan oleh kerajaan kepada pejabat awam. Sebab sekarang saya berdepan dengan masalah lain. Anda punya junior-junior, adik-adik sekarang ni diberikan jawatan kontrak. Jadi jawatan kontrak mereka tidak layak dapat HLP. Jadi itu satu cabaran yang terpaksa kami hadapi sekarang dengan berbincang dengan pihak-pihak agensi pusat bagaimana mereka dapat berpeluang. Dan anda memanglah yang amat bertuah. Oleh itu sebaik-baiknya gunalah peluang yang diberikan ini supaya dapat menjalani latihan kepakaran dengan penuh azam, penuh semangat serta memperoleh pengalaman dalam pengajian yang terbaik di Universiti Malaya. Pada masa yang sama, KKM committed dan akan bekerjasama dengan institusi pengajian tinggi termasuklah Universiti Malaya dalam pembangunan, pemantapan latihan kepakaran agar pakar-pakar perubatan kita adalah kompeten dan juga selamat dan berkualiti yang berintegriti ya. Kompeten, selamat, berkualiti dan berintegriti yang kita keluarkan dari program latihan yang mampan dengan suasana latihan yang kondusif. Kompeten penting. Kalau anda lulus master, anda tidak boleh diwartakan, anda tidak berjaya didaftar dalam NSR, anda masih lagi tidak kompeten. Sepanjang saya berkhidmat, ada beberapa kes sampai 3 tahun masih tidak boleh ada diwartakan. Itu kompeten penting. Selamat, ada juga yang kompeten tapi tak selamat. Tak boleh nak buat decision. Pesakit ada subrenal abscess tapi discharge. Ya, dan kita buat under supervision, ada beberapa pakar pun masih berlaku. Jadi selamat adalah penting. Yang ketiga yang berintegriti. Baru-baru ni di satu hospital pakar ada sexual harassment kepada houseman, dibuat sexual harassment kepada sales rep juga. Dan kebetulan ada gambar semua sekali. Jadi kita perlukan pakar perubatan yang kompeten, selamat dan berintegriti. Dan oleh itu saya mengambil peluang ini ya, mengakhiri ucapan ini dan sekali lagi mengucapkan setinggi-tinggi tahniah kepada semua calon program sarjana perubatan sesi 2021 yang akan memulakan perjalanan baru ya, perjalanan baru mulai Disember 2020 hingga 2025 dan mengorak langkah untuk lebih maju dalam karier perubatan ini. Biasakan dengan rutin norma baharu dan sentiasalah patuh dengan SOP. Kita belum ada vaksin. Satu-satunya vaksin yang kita ada adalah penjarakan fizikal, ya, 1 meter. Pakailah pelitup muka dan gunalah cuci tangan atau sanitizer. Dan amat penting di sini, ya, semua pelatih sarjana perubatan jangan ambil sambil lewa. Kita lihat, Kementerian Kesihatan ada membuat spot check, di mana ada juga dalam kalangan anggota perubatan yang apabila berada di hospital tidak memakai pelitup muka. Kita ada gambar dia. Dan ada juga yang tidak mengikut SOP, di mana apabila berada di pantry duduk rapat-rapat. Mereka membawang. Dan kita ada CCTV dan dapat kluster di hospital berkenaan, bukan daripada ward COVID. Untuk makluman, ward COVID adalah the safest place in the planet Earth to stay. Kita tak dapat lagi satu pun kes COVID dalam ward COVID. Tapi kita dapat banyak kes di mana? Di pantry. Di mana? On-call room. Di mana? Di bilik semayang. Di mana? Di tempat-tempat lain. Jadi inilah yang paling penting. Sentiasalah patuh SOP. Dan dengan ini, selamat maju jaya. Terima kasih, duku mukudu. Terima kasih. Thank you. I love all of you.
Thank you, Yang Berbahagia, Datuk Raizat. Before we end, I would like to read all of you a poem. Good doctors are confident. They believe in their ability, but they never lost sight of the importance of humility. For they know that they are not perfect. Effectiveness depends on their awareness that, as doctors, learning never ends. Good doctors will make sacrifices, and many times indeed. They set aside their personal life when a patient is in need. And most of all, they know it is not the thing that may possess us, but rather how they have cared for others. That is the true gauge of success. Be kind, be humble, be respectful and caring. If you have problems or some unhappiness, come and talk to us. Do not keep it to yourself. If you do not approach any of us, how do we know your problems and unhappiness? We are here to assist. Though we are not perfect, but we do our utmost best to each one of you can be the best. Kalau ada jarum yang patah, jangan disimpan di dalam peti. Kalau ada silap dan salah, jangan disimpan di dalam hati. With that, I would like to end this morning opening ceremony session. Thank you for your kind attention. Our next agenda is a lecture by a great professor, Professor Dr. Chan. She will give her lecture on working towards excellence in medicine. Prof. Chan.
Good morning, Professor Adiba, Professor Sharul, and thank you very much to our chairperson, the MC. And I'm going to share with you, as the MC has actually just mentioned, how to work towards excellence in medicine. And I'm just so honored, actually, to have been selected, not only this time, repeatedly over the last few years, to share with the intake for Universiti Malaya Faculty of Medicine every time. So it's not really an honor, it is actually an affirmation that I must probably belong to the League of Excellent Doctors. I'm actually an alumni from University Malaya itself. I graduated in 81, and I have worked over the major part of my career in University Malaya. It's an institution I love. I enjoy working here, and I would like to welcome all of you. In fact, an honor for me to be the first speaker as well, to welcome all of you to this great institution, which all of you will hopefully learn to love as well. I'm going to share with you my slides now. I hope I don't have too much difficulty with that. And just trying to figure out how to make it, just a minute, how to make it a complete screen. Go to this first slideshow, and then
go to the right. Go to that's it.
All right. Oh, okay. Very good, Prof. Adiba. You're really a very excellent director, even for slides. Okay. I know all of us do that all the time. Okay, so the topic is how to work towards excellence in medicine. I'm actually an anesthesiologist, but anesthesiologists are part of the discipline of medicine anyway. And why have I chosen anesthesiology? Because it is white-based. When I actually moved as an undergraduate into medicine and then into subspecialty, I had to look for something I thought should be white-based. And in that, being white-based, I have kept on in touch with all other disciplines of medicine, and I enjoy being updated all the time. And one of my subspecialty is actually education to a certain extent, and trying to share with others how to learn and how to be educated and how to continue their education in medicine. So focusing back on the topic again, I find it very amusing when I hear that while patients seek care from all of us in the hospital setting, we actually kill many patients as well in the process. In fact, it has been described that every day, not every year, but every day, 4 jumbo jet equivalent of patients are killed by care. So you do know that's all over the world, of course, not only limited to Malaysia, but all over the world. And the Americans in the year 1999, when they heard about human errors being all the cause of this problem, decided to wake up to the issue, and the Institute of Medicine then was commissioned to find out how we could do better by not killing patients as care providers. So in 2001, that's 2 years later, they came up with the attributes of what we call appropriate care. And I've lined it up for you here as an acronym, STEEP, so that you will forever remember. And what does STEEP actually stand for? It has to be care that is safe. Remember what our deputy DG said, safe, timely, effective, efficient, equitable, and patient-orientated. Now, you'll probably understand all these, but I'd like to highlight the word equitable. Equitable means equal access for every patient. Whether they are rich or poor, they should, in fact, it is a human right to be able to access medical care for yourself at any time you are in need of that care. And we do realize medical care is not equitable, especially to the migrant group in our presence as well. Well, hospitals are actually hazardous places, not even without the COVID situation. I'm sure a lot of patients do not want to go into the current healthcare system because of their fear of COVID. But of course, before COVID-19, it was already hazardous. And why is it hazardous? It is because of care providers like these who are not up to speed and who do not keep up and practice dangerously. So how do we then close the gaps in care that I've just pointed out to you? Well, it actually absolves us to close the gaps in learning. And again, we have actually been told as well, we have to focus on how we learn. And obviously, this is a lecture right at the start of your program so that once it is actually entrenched onto you, you will use it. In fact, I'm happy to share this set of slides with you, even the video if you have to get at it, so that you can repeatedly learn the things and that I'm going to highlight for you, just in case it slips your mind and your memory in the next 4 years. So what I intend to do is to define excellence for you, build a profile of excellence, and tell you why we need to work towards excellence and how to do it. Well, as I said, I'm an anesthesiologist, and as anesthesiologists, we see ourselves as professional artists looking after patients as a person with physiological needs. And in fact, I am a physiology examiner in the Masters of Anesthesiology program. And not only am I an examiner, I love the subject so much. I have written books on it as well. And at the present moment, I am looking at writing another book called Essence of Life to share with you this love of mine, as well as to share with you what looking after physiologic needs of patients truly are. Okay, we are also good Samaritans. We treat the patient as a person. And we are servants to close gaps in care. In the hospital system, obviously, not all hospital systems are perfect. There are gaps. And as an anesthesiologist, we do our utmost and help to close those gaps in care. And working in the operating environment, we are great coordinators, providing care in terms of priority because there are so many patients, so many surgeons in need of helping their patients. We've got to learn to prioritize these cases so that everybody's needs are met and balance it with our limited resources. And as you know, with the pandemic, it's getting even more limited as lists are cut down to make way for our COVID-19 infected patients. So as this lecture is intended not only for the anesthesiologists in the group, but meant for the whole population of, I do understand, 300 of you here, I'm going to touch on the 7 roles of a medical practitioner that has been framed by the Canadian Medical Association in 2015. So what is this CanMed framework? It's actually a framework that identifies and describes the abilities of physicians that is required to effectively meet the healthcare needs of the people they serve. These abilities are grouped thematically under 7 roles, as you can see here, and a competent, notice the word that has also been used by Dr. Rohaizat, a competent physician seamlessly integrates the competencies of all 7 CanMed roles. Of course, you're a medical expert, or you soon will be after your training or during your training itself. And in achieving this, you work towards being a professional, a good communicator. I note that he also mentioned learn how to communicate, and somewhere in the lecture, I will also emphasize on that. You are going to be learning how to be a collaborator, a worker in a team, and obviously, you will be a leader and a health advocate as well, because many of the people that you work with will see what you stand for in terms of vaccines, for example, that is coming, and figuring out how to go from there. And you will continue to be a scholar, just like I have, and contribute to the scholarly activities around you. So let me explain to you these 7 roles and what exactly they mean. So what do you mean when you say, or when we say we're going to train you to be a medical expert that integrates all the other roles, all right? So we are actually going to train you to be physicians of all types, where you integrate all your 7 roles, and where you apply medical knowledge, clinical skills, professional values in the provision of high quality and safe patient-centered care. And being a medical expert is the central physician role in this framework and defines your clinical scope of practice. So all of you are not going to be anesthesiologists, obviously, but you'll be surgeons, you'll be internal physician, you'll be an orthopedic surgeon, as well as probably obstetrician and gynecologist. So all of you will have that body of knowledge peculiar to your subdiscipline, but you will still share common roles as well, which is chief of which being a good communicator. It is through communication and good communication that we form relationships amicably with our patients and their families to facilitate the gathering and sharing of essential information for effective healthcare. Notice the word effective as well that was used by Dato' Rohaizat. And it is true, it is one of the attributes of appropriate care. The care must be effective. And you are going to learn to be a collaborator, to work effectively with other healthcare professionals to provide safe, high quality, patient-centered care. So it all boils down to focus on your patient at all times and their needs, whether physiology for me, like as an anesthesiologist, mainly physiological, but for all other disciplines where patients interact with you as well at all times, their emotional needs and other physical needs. And obviously, as I mentioned, you're going to be a leader, engaging with others to contribute to a vision of a high quality healthcare system and to take responsibility for the delivery of excellent patient care through your activities in the several roles you will play as clinicians or even as administrators, scholars, or teachers like me. All right, that's why I volunteered to actually speak, and I continue to teach as well and continue to share my knowledge. Health advocate, it is something that a lot of you may not recognize as important. In fact, when I was junior, I actually did not recognize this health advocacy part of me. But obviously, when I have more to share and more that I understand and I need the public to know of, I've done a lot of health advocacy on my part as well. In fact, now I'm currently in the Academy of Medicine Council, and we do advocate for many issues. We have our statements sent out to make sure the public knows where our stand is to move everybody in the correct direction. So we contribute our expertise and influence as we work with communities or patient population to improve health. Now, more than ever with the COVID-19 pandemic, advocacy in the correct direction is important. So we work with those we serve to determine and understand their needs, to speak on behalf of others, especially those patients who are vulnerable and cannot articulate their needs, but you, because of your expertise, know exactly what they need. And then you provide what is required and, more important, support the mobilization of resources to effect the change. Of course, all of us realize we have to move on with the times and to be up to date with our learning. And I have done so for the last 30 odd years since I became a specialist. Otherwise, I will stagnate in time to the time when I was a specialist and think I'm the greatest scholar in the world. No. Scholarship or knowledge has moved on since I last graduated, and I have to learn many, many things along the way. It's called the Open University, and who actually educates me? It is students like all of you when you ask questions that are relevant or even irrelevant, because I then need to figure out why you are thinking along those lines, and I use this material that you have to educate myself. And of course, the most important stimulator for learning comes from their patients and their anxieties and their needs. And whenever I can't meet those needs, I use that as an impetus to learn how to do so. So it is with lifelong learning do you actually get to excellence in practice, and it is with continuous learning. And notice, teaching others. I've been doing that since I was 6 years old, by the way, because teaching has always been in my blood. It is actually a value that I've been instilled with, and I'm so glad that I do have that passion to teach others, because it is by teaching others that actually allows you to learn. Evaluating evidence of the environment around you, as well as sharing or looking at evidence produced by others, so that all the evidence to support further growth in our medical field are true and not fake, and you then contribute to scholarship so that more and more people are aware of what needs to be done or to be learned. And lastly, as professionals, physicians are committed to the health and well-being of individual patients and societies through ethical practice. Note, this was also highlighted earlier, high personal standards of behavior. And you would remember Prof. Adiba and Prof. Sharu says that you need to look after yourself as well, so that it is by keeping a healthy body, a healthy mindset, that you can help others. Accountability to the profession and society, physician-led regulation and maintenance of personal health. Now, this physician-led regulation is very important. We are actually, with the several bodies with the several controlling bodies like the Academy of Medicine and the Malaysian Medical Council, actually leads in the regulation. And being in the Academy of Medicine as well, I strongly believe this is very important. And on a more personal note, I do take part in a lot of medical legal work as well as an expert witness. And in so doing, I feel that I'm contributing to some kind of physician-led regulation, so that I allow my expertise to be accessible to patients, especially patients who have been done wrong by the profession. It is to keep everybody on their toe, so that we maintain a certain standard of care. Okay, let's look at what excellence is all about. Excellence is when we are able to connect with our knowledge and skills in ways far above that of mere technicians. Obviously, I've not met any one of you, but I have met some of your predecessors, and some of them are actually in the stage of being technicians. And usually when I tell them, when I'm around with them, when they actually share with me their experiences, I tell them that, you know, you are actually a good technical doctor, but you haven't really grasped the professional part of care. So they know when they exit from the system, they have become professionals, and they tell me, Prof. YK, we've turned from technicians to professionals. And they're very thankful for me for converting them to that. Excellence is doing ordinary things extraordinarily well. All right, so what exactly do we mean when we say excellence contains professional, those with excellence contain or has professional values and personal commitment? All right, they actually have the skills and the abilities in them, or they have developed it along the way, or would be developing along the way, and they use this knowledge and understanding and put them into action, so that you will see in display professional values and personal commitment in them. So how do you define professionalism in care? Well, this person, John Telstaff, says, I don't know what it is, but I know it when I see it. So you can see these are some of the attributes that I have to share with you, and professionals have all these attributes, or a large proportion of these attributes that I put for you here. And A professional is someone who can do his best work when he does not feel like it. It may not be it might be a bad hair day for you, but if you are a professional, you will do it and display your professionalism at all times. You have to perform at a consistently higher level than others, and that's the mark of a true professional. So professionalism has nothing to do with getting paid for your services. And professionalism makes you stand out from the crowd. And professionalism distinguishes the best. All right, so it's more than a list of values that I've shared with you or the list of desired behaviors. It is actually a foundational understanding only. And professionalism is actually a motivating force that allows you to display and enforce the display of shared promises that the medical faculty or fraternity have actually all looked at to ensure that practitioners are worthy of patients and the public's trust. All right, so at the present moment, the public and a lot of our patients have very high trust in all of us because we have that. It's a very professional discipline that you are all in. And professionalism in all of us will continuously define, debate, declare, distribute, and enforce shared competency of a certain standard and ethical value. And that shared competency, standards, and ethical values will govern our work with the public as well as with individual patients. So let's see how we can work towards excellence. Now, it actually encompasses a lot of other elements other than book knowledge that you think in your 4 years here with us, you are going to be confining yourself to. We would like at this stage, the opening part of this program for you to understand these are practice elements that are going to be very important if you're going to become a professional. And we would like you to put some attention into elements like task management, team working, decision making, and situational awareness. So that by the time in the 4 years you are with us, we can convert you and be proud of the fact that you are going to be part of the alumni in Universiti Malaya. In fact, the alumni and all graduates from Universiti Malaya, whether as an undergraduate or postgraduate, has been noticed or noted to be of extremely high quality. We are different, all right? Just like I'm different from a lot of others who have graduated elsewhere. And that's why I've worked and been retained even now as I retire to continue the process of education for all of you. So UM is of higher caliber than a lot of other places or graduates from other places. So please note that you're very lucky and you have teachers who are going to change you in that direction. And this is anesthesiologist, non-technical skills, but it is can be universally applied as well. But because it's anesthesiologist, non-technical skills, Glavin has actually shorten it to ENS so that you can remember, all right? So what exactly is ENS? As I said, we are looking at task management, how we plan and prepare our patients, how we prioritize our list so that we, in spite of setbacks and in spite of so many demands on us, can provide care and maintain it within a certain standard. And even though we are limited by lots of resources, we identify these resources and utilize it to the best of our ability. And obviously, anesthesiology involves a lot of teamwork, all right? Not only teams from the Department of Anesthesiology, but also teams from all other disciplines. if you remember, one of the reasons why I loved anesthesia, or I actually embarked on anesthesia, was its wide base. I touched base with so many other team members, and that means I have to work utmost to be able to coordinate my activities with theirs to meet the needs of patients. And in so doing, I have to exchange information with the authorities as well as with others while we provide for these needs. So I'm going to deviate a little bit with this next emphasis on how to communicate. I'm not very sure how many of you have come across this way of communication, the ISBAR technique, but if you haven't, don't worry, because when I was younger, I didn't realize what all these ways of communication was, but I did notice one thing. The consultants in all our discipline, when they exchange information, they do it in a very crisp manner. And just with a few very stark statements, they manage to convey their issues and their problems, and they get help. So this has actually, ISBAR has actually come from the military. And you know, medicine from military has always been described as precise. So they do have a precise way so that, you know, once the information is transferred, they know how to take it from there. So ISBAR, what exactly does it stand for? I stands for identity of the patient and the caller. And the next one is situation. What is the problem that you need attention for? It can be either a problem or a symptom, and whether the patient is stable or the level of concern. You have to make it quite precise, because especially if the other person is at the other end of the line, they have no visual imagination to know how distressed the situation is to you or to the patient themselves. So you have to make it so precise that that consultant over the other side, or that person the other side, can imagine, and make it short. It's almost like the headline in the your newspaper every day, okay? Like, for example, I have a patient that has bled 3 liters of blood, or hemorrhaged 3 liters of blood. All right, I'm an obstetric anesthesiologist, so my scenario seems to come from that side. Now, so once you've framed the scenario or the situation, then only do you do the background. Because, you know, when you are undergraduate, taking history, you tend to not emphasize too much on the situation, but more on the background. And I don't want to hear, you know, instead of situation, I don't want you to tell me, I got a Gravida 10, Para 9, you know, to explain the hemorrhage that the patient is in. So put the situation so that I know the patient has bled 3 liters out of the 5 liters she has in her. And the background is she's a multip, a grand multip, and she just has come in unbooked. All right. And you know, that will frame the situation and the background. And tell me what you have done. Oh, I've set 2 large bore. I've given her now 1.5 liters of unmatched blood. All right. So you have done that. And what exactly is your impression of the situation? You can probably tell me. Earlier on, the blood pressure was in the boots, but now her blood pressure is more palpable. And what do you want done now, since you've actually spoken to me as a consultant, or maybe the obstetrician, and you would like them to come over to help you? So a lot of us, because we have not been schooled properly in communication, we will tell our consultant, I want you to come in. Now that, as a consultant, now that I've lots of experiences, may actually sound a bit rude. This medical officer wants me to go in. It's like a demand, okay? So how do you frame it? I would like you to keep in your mind a word that I've always trained my younger doctors to do. I tell them to tell the consultant, I prefer that you come in to help me because I'm really in trouble. That would be a better way. Use the word preferred. if you don't understand how this word magically affects you, the advertisers do. All of you own credit cards, I'm very sure, and they use this word preferred credit card, you know, maybe preferred Visa or preferred what other credit cards that you have. And you notice their word or selection of this word preferred. It is a magic word that will change every consultant who feels that they don't need to come in or don't want to come in because you told them to come in. But when you say, I prefer that you come in other words, you are very kindly telling the consultant, I'm giving you a choice actually, consultant, but you actually have no choice. The consultant, when they hear the situation, the background, and this poor trainee giving her or him the option and telling him in a very humble way, I prefer that you come in. So you either don't come in or you come in, but I prefer. So it's actually stating in no uncertain terms what exactly you want the consultant to do or the person the other side to do, even if you're talking to a surgeon or a nasty whatever on the other side, and you tell them, it is like pleading with them, please help. All right. So coming back to this same slide, you notice part of the non-technical skills is the issue of situational awareness. What exactly is situational awareness? If again, I would like you to look around at your seniors as well as your consultants, how when they come in, the first question that's on their mind as well as they ask would be, are we all right? There's a bit of interruption. Okay. As they come in would be, doctor, what is the situation? Is the situation under control? So when they ask this question, they are actually gathering information to recognize and understand what exactly is happening. And you notice how the consultant, when the consultant comes in, especially for a CPR, they won't take over the cardiac massage, neither, unless of course, or take control of the airway. They would, if obviously, if they have to, if looking at the situation, nobody seems to be in control of the airway, they might, but usually that's all they would do, because by being at the head end, you can actually see what is happening and continue to gather information. And they will probably, as a consultant, I would, if they are in trouble with the airway, I'll take over. And then after that, I would just continue to gently ventilate the patient and gathering more information from the screen as well as the circumstances around. And I will send out instructions as to how to continue, because you need energy as well as time to gather the information as you land yourself in an unfamiliar situation. So please focus your attention on how to build situational awareness for yourself, because a good consultant and excellent provider has got high situational awareness, and you have seen how they do it, and you will continue to learn how to do it. It is when you are aware and in full control of the situation, can you look at your options for the patient. Then you can identify the risk and select the best option. And of course, things normally change as we go along, and you re-evaluate the situation and make better and better options once your earlier option is not good. So as an anesthesiologist, I have always told my juniors, gather your information and have plans. Plan A, plan B, and in more difficult situations, plan C. And especially with the air, where airway is concerned, I have got trainees who come back. Prof YK, what's the plan for this patient? This is a difficult situation. We need plan D as well. So as I said, my trainees do teach me and sometimes remind me what I need to do. And I'm thankful, especially in very difficult situations where I may not be focusing on the right thing. They are there to remind me to take stock. So how do you enhance excellence? Since it is actually a non-measurable competency. Unlike book knowledge, unlike skills where we can actually measure your competency, excellence, professionalism, and all that I have told you are not measurable, but very important competencies to have. Notice Dato' Rohaizat also mentioned competency, all right? But while I say that it's not measurable, it can be enhanced through training. That's why you're here with us for the next 4 years. And that's why this lecture is done to entrain your mind to understand this is the very important aspect and can be trained into you. And to provide the necessary experience so that you can move in the correct direction to enhance your excellence and to have continued reflection. All these measures will improve your tacit knowledge. So notice I've used tacit knowledge. So let's look at tacit knowledge and what exactly we are looking at in those terms. Well, tacit knowledge is actually implicit knowledge. Knowledge that is hidden inside you as you build up your repertoire of knowledge. All right? And how do we learn actually? A lot of us don't realize, but it is through the socializing process. You socialize or interact with your patients and the relatives and with the environment and with other care providers. So it is something that is external to a certain extent. And what we need you to do, especially when you frame it for the consultant, you are actually articulating. If you can see this word, it is you articulate the whole situation, you articulate your concerns, and by articulating, you actually tell your brain and you frame it for yourself, you frame it for others. And with that too, although it still is explicit, and you do it often enough, you begin to internalize it. You begin to internalize it for yourself. In fact, I would advise all of you to continue to reflect every evening when you go back to your home or at the end of the day, what you have learned in terms of the clinical situation. Reflect on those processes that you've experienced. Some may be good, some may be you would consider setbacks. Let's say you've got a feedback from somebody that you've done not quite correctly. So learn how to frame it for yourself and actually learn to internalize those advice. And after that, repeat the whole process, and with continued repetition and reflection, you begin to internalize. So implicit knowledge is knowledge that is inside you. The knowledge that has gone to make what we call unconscious competence. So let's look at competency and its 4 stages. Well, most of us, when we don't know a skill or we don't know something, we are not aware of it. So that is called unconsciously incompetent stage of something. All right. You don't recognize you have the deficit. So I'm very sure a lot of us in the stage that you are probably in, you don't recognize that professionalism and all the things that I have actually highlighted for you should be something in you. So you are unconsciously incompetent with that respect of professionalism. Now that I have actually brought up this issue for you, you are now conscious of it, but you are still obviously with one lecture, you are not competent. So you then move into the stage that you recognize that you are incompetent and you are consciously aware of it. You recognize your deficit. In fact, those people who arrive at competency faster, you know, the good scholars and the good learners and all that, a lot of them are at this stage. So they skip the stage of unconsciously incompetent stage. In other words, they use all the feedbacks that they have and say, oh yeah, I have to admit to myself that I'm not a professional. So you are already moved right from unconscious incompetence to conscious competence. All right, so that's where wise men actually stay. They know, they ask the relevant question and they know they are in conscious incompetency and they move upwards faster than a person who remains in the unconscious incompetence domain. So then when you are in the conscious incompetency state, you then tell yourself, I must put my energy into becoming consciously competent. So what you do actually needs a lot of energy. You then eventually know how to do it, but it has a heavy conscious involvement. It needs a lot of energy from you. All right. And when you come to the state of unconscious competency, like for me now giving you the lecture, I'm not focusing on myself. I'm actually focusing on you as a participant, where I'm focusing on the message I want to pass you. So it's a skill that has become second nature to me. If you want me to sing at this stage, I probably can, but I'm not a good singer. But I'm giving you a lecture and I'm very comfortable in the comfort of my home to share with you what this is all about. So it's actually a minimum effort to me. I'm almost enjoying the task. So let's look at this state of tacit knowledge and competency as well. So tacit knowledge is a dimension of knowledge that is inherent in us once we reach the state of unconscious competence. It is, we are so comfortable with it, we don't even recognize. That's why it's unconscious competency. It's a bit like the ballerina that you see dancing away, you know, with all their moves in alignment. They're not aware that they are so good. They are able to focus all their energy into that kind of performance. Now, just as an aside, we will look at Lee Chong Wei, and you would agree that when he was the world number one, ranked world number one, he was actually in the state of unconscious competency. And most times he will be in that state whenever he plays his badminton. However, when he meets this nemesis of his called Lin Dan from China, he moves back into this conscious competency state. That means he actually deviates that state of his mind back into conscious competency. And if you remember, I said it is very energy consuming. So instead of using that energy to play a good game where he can still remain as number one, he now becomes consciously aware and he diverts a lot of his energy to focusing on Lin Dan and his next move and anticipating that. And that is the price he has to pay when he moves back to conscious competency. He always loses those games when he moves back in that state. All right. So during exams as well, a lot of you may have arrived from conscious incompetency to conscious competency. And because you are so occupied with anxiety, you actually decrease in your performance. So I would want you to learn the art of sharing with your examiner what you know, want to display to them and do it with ease. All right. When you are comfortable with your knowledge, your skills and all that, learn to share. Just like a teacher learning to share all the time. After that, it becomes second nature for you to share your knowledge. And your examiner will say, wow, he is top grade. I'll put him as a consultant. Yeah, because consultants are into unconscious competency state as well already. Yes, so for a consultant or professional or somebody who's excellent, knowledge stays in the background and it's all integrated as already as part of the professional person, and it is used to guide the clinical management of a clinical phenomenon and situation. And they do it so effortlessly. All right, look at your consultants, the good ones, especially, and they won't say, let me look at something to guide you. They actually, it kind of comes on spontaneously out of them. So are there any obstacles to working towards excellence? Yes, unfortunately. It is very much present in our system. And I would like you to recognize that and to work around it. All right. Now, I do know all of us in our system have rules and protocols and guidelines. Well, these rules, protocols, and guidelines are meant for everybody's consumption so as to guide us as a team to move forward. But please do not use it explicitly as a base for learning, because it will prevent you from reaching the advanced levels of excellent practitioners, because it will take away learning. You are not going to look at why these protocols are in place like that, and you are not going to consider, what does this patient need this antibiotic? Does this patient need it for that duration? Or does this patient need that amount of dose? Maybe the patient is in renal failure. So some of them may be part of that guideline, but others may have left, because protocols and guidelines are man-made anyway. And every patient as an individual has different needs. So while you use guidelines and protocols, be mindful of the special needs of each individual patient. And as a consultant and one that is looking at excellence all the time, I use the guidelines as a guide, but I always match it with the individual needs of the patient and look at how I can look after the needs with a proper plan for the patient. And I may have to deviate from those guidelines for whatever reasons. So we don't like to train you by the book. And if you insist on training by the book, you are actually at risk of not acquiring the tacit knowledge that you need, especially when you look at complex and challenging situations. As you move further and further up the scale of learning, or in the next, not 4 years, but when you become consultant and as you move further and further into care, you will find more and more challenging situations that you cannot call for others to help you. So you need to build that body of knowledge, how to do it properly, so that every patient can be attended to in terms of meeting the situation, meeting their needs. The other way of ensuring that you will arrive at the stage of excellence is to have inspiring coaches. Now, this has come from an article written by Atul Gawande. I'm not sure whether any one of you remember Atul Gawande. By the way, the surgeons should, because he actually is a surgeon in the United States of America, and he was one of the prime movers of safe surgery saves life. In fact, how to make sure that you check the various systems so that patients do not fall in between your gaps in the system. And he has written books like Checklist, and he's actually a very renowned speaker as well. In fact, Atul Gawande didn't start life as a surgeon. His parents were doctors, and what happened was he didn't quite like medicine, because he realized his parents as doctors had to work very hard. So what he did was he went to Oxford and trained as an economist. So he actually had top honors for the subject, and he went home to the States. But after a while, he realized as an economist, he was not going to survive. And he decided, after some persuasion, to actually explore medicine. Now, because he had the sense of economy, or the economic mind in him was still in place, when he graduated, he married the two, and Bill Clinton actually used him as an advisor. And that's how he moved on to combine and make sure that his economic knowledge also came to the fore in medicine. And he became responsible for the Safe Surgery Saves Lives, so that you look at some of the economic part in the system. Now, so when he was a surgeon at the end of 8 years in his surgical career, looked around and said, hey, I have plateaued in my performance. So who do you think I should get to help me? He says, after all these players have got coaches. Why can't I have a coach for myself too? So he actually looked up his old professors, and one of them, of course, volunteered to help him, and did that. Just like Lee Chong Wei, when he's world number 1, does he need a coach? You would say, obviously not. But a coach is actually very special. They need not be better than you. They are just somebody who will walk along with you through because of their experience, but they are there to support you. In fact, they are there not only to support, they are there to help you in your times of distress, teach you other things that you are not aware of, guide you, advise, support, and encourage. I have been a coach for many of my juniors. In fact, I will leave you my email, and I can be a coach whenever you feel down and whenever you need support to be an excellent provider. And for those of us who are already very high up in the practice of medicine, obviously we have got less and lesser people who want to volunteer to be our coach because they're just too shy to be your coach. All right, so how do you then arrive at being excellent or good? Obviously, work hard. Practice makes perfect. Now, this is actually something that came out in 1998, but it is a very important piece of information. They have found that if you take intubation as a skill, you need almost about 60 attempts to perfect your skill so that you feel comfortable and are able to do it. Now, as an anesthesiologist, I am very sure all my non-anesthesiology colleague looks at me or us as a team and say, oh my God, she's so good with her airway management, or she's so good with her intubation. Yes, we've done more than 60 times. I can't personally remember how many times, probably thousands and thousands of times. But I can very definitely recall what it was all about when I was a house officer in the presence of a medical officer who didn't know. And here, while a patient needed intubation to sort out the airway, there were 2 of us, house officers, and this senior, this not so quite senior, but this medical officer who was our senior. So obviously in the arrest, he was supposed to be intubating. And why it has remained in my memory is because as he was intubating, he didn't know what he was looking at. And he then asked this question: is the larynx anterior or posterior? So obviously we say it's anterior because this patient is lying down, right? And the next question, or rather the next statement that we made, both of us as house officers, looking at this poor medical officer who is supposed to be our leader and telling us what next to do, was he was still like a bit puzzled as to what anterior, posterior was all about. So we say, up, up, up. The larynx is up there, all right? So I have obviously moved from those times when I was a house officer to now as a retired professor, and intubation is second nature to me. So I'm in the unconsciously competent state of intubation, and obviously it has come through very much hard practice on my part. So we're near the end, and I'm going to share this quote with all of you from Francis Bacon. Reading makes a fool man. And I'm very sure a lot of you are stuck in that stage only because somehow, while this is the total quotation from him, a lot of us only get to hear about reading make a fool man. But I'm going to add for you today, conference a ready man. Now, I don't mean attending conference when I say conference a ready man, but it is the interaction. Every interaction you have with your patient, with your consultant, with your peers is actually a conference. So all this interaction will make you a ready man. And writing an exact man. Now, what does writing mean to all of you? I'm not very sure, but writing, when you put your brain power on paper, you are actually making sure you recognize what is inside your brain, because now you can see your brain power in display. That's why in your exam you have a written, you've got a multiple choice, and then you've got a written portion where you have to answer question. That is to allow the examiner to see what is in your brain, so that they know exactly what level of competency or function you are at with the scenarios that they share with you. So please do focus on some writing, reflection of your cases. Write it down if you have to, because it helps to make you an exact person. And then when you have read an article, write down in abstract form or in presse form what you have learned. Because when you articulate, when you write down, you begin to articulate a lot better. And I have done that, and this is the product of my articulation. I have transformed it to books, and books that are meant to help all of you. In fact, if you've got the time and the energy, do go and look at some of these books, and especially for those of you who are in anesthesiology, go for the physiological basis of acute care and pharmacological basis of acute care, because this is articulation of what I feel all of us as providers need to have as the basis of the care that we provide, because a lot of books in these two subjects of physiology and pharmacology have been written by authors who have no clinical knowledge and who does not understand we need an integrated knowledge of basic science as well as the clinical aspects of how it is applied, and have a helicopter view of what exactly the care should be. Obviously, I have integrated in these two disciplines now, and because of the integration, I have a lot of what I said, tacit knowledge or implicit knowledge on these two subjects, physiology especially, in which I examine, but used to train or teach every day in my juniors. And I kind of emphasize to them how to look at it and not allow them to disappear from your knowledge. Otherwise, if you continue to practice according to, oh, what do others tell you to do, you are actually merely going to be a technician. You have to integrate what is best for yourself and then learn to understand why you do what you do, including why you give the drugs for and how is it absorbed. You must learn how to integrate all this. Otherwise, you are going to stagnate as well and not be a professional. Now, while I say it is especially good for the anesthesiologists in the team here, even the non-anesthesiologists might want to have a look at the book and use your physiology and pharmacology as the basis of what you do. Don't stay and when I ask you, what is the oxygen for? Oh, oxygen is for breathing. No, that's not true. Oxygen, in fact, they didn't tell you at the Krebs cycle, oxygen is a facilitator for energy conversion from the glucose to the ATP. All right. In the absence of oxygen at the tissue level, the conversion is very poor. You only get 1 mole of glucose to convert to 2 moles of ATP. But in the presence of oxygen, it converts to 38 moles of ATP. That's why as an anesthesiologist, we need to sort out the airway so that the oxygen can move into the gas exchange site. That's why you need proper breathing. And the cardiovascular system, the role is to get the oxygen and nutrients to the tissue. So that's why you need A, B, C. And you need to have enough hemoglobin. And you need to have an adequate microcirculation. All this is to bring the oxygen in. That's the essence of life. So you have to know that this has not been properly taught you. And this essentially is very much missing in your understanding of what life is all about. And if I ask you the other critical question, why do you need ATP at the cellular level? And that's because every cell is under threat all the time. The sodium outside is high, 145, millimoles per liter. The sodium inside is very low at 10. And you need the sodium potassium pump to always pump in the sodium whenever it drops in. Now, without ATP, or rather without the oxygen and without the ATP, the sodium pump cannot work. And you need the sodium pump to work for your cell to stay alive. If the cell die, if the sodium potassium pump, because oxygen is not coming, ATP is not available, you will find that the cell dies. And then the sodium moves in because the pump is not pumping it out, and the water comes in, so you have cell death. When many cells die, you're going to get tissue death. And many tissues die, you're going to get organ death. That's why in sepsis, where you have failed microcirculation, you have multiple organ failure, and ultimately the patient dies. So this is physiology, but has anybody put that to you? Obviously not. I was just speaking to a young junior doctor yesterday from Australia, and she was so astounded by what I had to share with her. And you, as a junior doctor as well, on this first leg of your journey to becoming a professional and a senior specialist or consultant later, please build this into your system and learn things the correct way. We have a lot to repair in our system of education. I'm really doing my utmost besides contributing in this. I am working with a physiologist to relook at how we can teach physiology. I'm doing my utmost, but I want you to begin that journey with me. Okay, finally, this is your final slide. We are what we repeatedly do. Excellence, therefore, is not an act, but a habit. I've made it a habit to learn and reflect every day, as well as to spread the message. And I think you would agree with me. What Aristotle says is very true. After a while of having that habit of wanting to learn, wanting to share, wanting to do good, you will find that it is not so difficult after all. And here, if you collect nothing, just collect a snapshot of my email, and I can be your coach anytime. I'm fairly retired, as I said now. I won't say I've got plenty of time, but I can always make time for anybody who needs one, in terms of advice, in terms of being a supporter, in terms of helping in whatever ways. I'm sure a lot of you know somebody who knows me who will say she's always willing to help. And I'm here to help you take this journey through, and especially through difficult times like this, where we need all of you to help each other keep safe and stay safe. Have a good day, all of you. Thank you for listening.